Every technique, every observation, and every patient encounter has led us here to the heart of healing's hidden language. Neuro-Conscious Resonance Therapy, or NCRT, is not just a manual therapy, it's a living dialogue between body, awareness, and energy. It is where touch transforms into perception, and perception transforms into healing intelligence. We've long treated pain as a problem of tissues, joints, or nerves. But beneath those layers lies an unseen dimension, the field of conscious resonance. Healing begins not when we manipulate tissue, but when the patient's nervous system feels safe enough to realign itself. The therapist's awareness acts as a tuning fork, inviting the body to remember its natural rhythm. Resonance, in scientific terms, is synchronization a state when two oscillating systems begin to vibrate at the same frequency. In physiology, this occurs between the brain, heart, fascia, and breath. Research shows that when these rhythms synchronize, heart rate variability improves, neural noise decreases, and tissue repair accelerates. In NCRT, this synchronization is consciously guided through awareness, touch, and breath. The roots of NCRT lie in decades of clinical exploration by Dr. Km Annamalai. Observing thousands of patients, he noticed something extraordinary: pain, often released not through pressure, but through presence. These observations evolved into a refined system where the therapist's intention, micro-movement, and patient's perception merge into a single continuum of healing. Thus, NCRT was born as the conscious evolution of physiotherapy. The technique rests on 7 foundational pillars. 1. Grounded awareness. Healing begins with stillness, not action. 2. Heart entrainment. Coherence between cardiac rhythm and consciousness. 3. Resonant contact. Touch that listens rather than imposes. 4. Micro-oscillation scan. Perceiving the fascia's living dialogue. 5. Breath mirror technique. Synchronizing respiration to restore neural balance. 6. Quantum release touch. Letting stored sympathetic energy dissolve. 7. Integration silence. The pause that allows reorganization and renewal. Together, these create the bridge between anatomy and awareness. NCRT inherits its precision and diagnostic clarity from the KCAT legacy, Dr. Annamalai's pioneering physiotherapeutic framework. While KCAT focused on kinetic correction through mechanical intelligence, NCRT extends it to the neuro-conscious dimension. Here, the fascia is not just connective tissue, it's an intelligent medium for bioelectrical communication. KCAT aligned the body. NCRT aligns the field that moves the body. A 4 or 5-year-old violinist came with years of shoulder pain unrelieved by conventional therapy. During NCRT, the therapist didn't target the shoulder but tuned into thoracic fascia resonance. Within minutes, she described a wave, music under my skin. Her pain gradually melted over sessions, but more importantly, she regained her posture and ease of performance. This illustrates the paradox: when the therapist stops fixing, true correction begins. A young man with partial hemiparesis post-stroke underwent NCRT sessions integrated with KCAT mobilization. Instead of repetitive stretching, the therapist worked through conscious resonance, aligning his breath and attention with microfascial oscillations. After 5 sessions, reflex spasticity reduced significantly and voluntary hand control improved. Here we see neuroplastic awakening, when awareness and touch re-educate the brain through resonance. NCRT opens new horizons for research. Neurophysiological, mapping how resonance modulates sensory gating. Biomechanical, tracking microtissue oscillations via motion sensors. Psychophysiological, studying heart, brain coherence under therapeutic touch. Early pilot studies suggest resonance entrainment may activate parasympathetic recovery faster than conventional methods. Our goal: to translate observation into quantifiable data, bridging intuition with measurable science. For therapists, NCRT begins with internal calibration. Step 1. Align your spine and steady your breath. Step 2. Feel your pulse in your palms. Project that coherence into your touch. Step 3. Hover your hands. Wait for the body's rhythm to meet yours. Then merge, not manipulate. Step 4. When resonance stabilizes, step back in silence. The body will continue to reorganize itself. In NCRT, pressure is replaced by presence. To the patient, NCRT feels like deep listening. Many describe sensations of warmth, vibration, or gentle waves within their body. It's the nervous system rediscovering harmony, not externally imposed, but internally invited. Recovery becomes participation, not dependence. Every session is a conversation between the patient's awareness and their own healing intelligence. Healing, in its purest form, is the reunion of awareness and biology. NCRT demonstrates that spiritual consciousness is not opposed to science. It is the missing variable science is learning to measure. The therapist becomes a witness to nature's intelligence unfolding. Awareness, coherence, and compassion together become measurable frequencies of recovery. GENS. As the world of physiotherapy moves beyond muscles and joints, the next era belongs to integration. NCRT proposes a unified model combining neurological feedback, fascial intelligence, and conscious resonance. It opens the possibility of collaboration among physiotherapists, neuroscientists, psychologists, and bioengineers. The clinic of the future will treat movement, emotion, and awareness as one continuum. What we do with our hands matters, but what we hold in our awareness matters more. The highest form of therapy is not manipulation, it's mindful presence. When therapist and patient share one rhythm, healing becomes inevitable. That is the quiet revolution of neuro-conscious resonance therapy. Every technique we've explored so far leads to this point, the rarest gem of neuro-conscious resonance therapy. This is where touch transforms into perception, and perception transforms into awareness. Step 1. Grounding alignment. The session begins not with action, but stillness. The therapist's spine becomes an antenna, vertical, balanced, and alert. Breathing follows a 6-in, 6-out rhythm. This synchronizes baroreceptors, balances vagal tone, and prepares the nervous system for coherent resonance. As the breath stabilizes, cortical noise fades. In that internal quiet, your presence becomes measurable energy. Step 2. Heart entrainment. Awareness drops behind the sternum about 3 centimeters inward, where cardiac energy radiates like a low-frequency wave. When you feel your heartbeat expand into your palms, you are literally projecting a coherent electromagnetic field. Heart-brain synchrony increases alpha amplitude, and that calm signal extends outward into the patient's field. Healing begins before contact through resonance of rhythm. Step 3. Resonant contact. Now, hover your hands above the patient and listen. Every tissue emits a micro-oscillatory signature, a faint pulse of heat, motion, and charge. Wait until both rhythms, yours and theirs, converge. The moment of convergence is subtle. You may feel a slight expansion, a weightless magnetism. That is the fascia's language saying, "I'm ready." Touch then, not to impose, but to merge. Step 4. Micro-oscillation scan. With fingertips gliding 1 to 2 millimeters, you're not pressing, you're perceiving. Micropulses under the skin reveal fascial tension fields. Each rhythmic variation represents information, hydration, ionic balance, emotional imprint. In that listening, you become the instrument that decodes living tissue. Research on piezoelectric fascia supports this light mechanical resonance, alters calcium signaling and cellular communication. Step 5. Breath mirror technique. Now, guide the patient into synchronous breathing. Inhale, tissues expand. Fluid conductivity rises. Exhale, sympathetic tone drops. Parasympathetic repair begins. When breath, awareness, and micromotion align, the body relearns its native rhythm. Trick 1. Replace pressure with presence. Remember, mechanical force travels slower than electromagnetic intention. When intention leads, muscles follow without resistance. This is the quantum principle of observer influence. Presence is a frequency. Trick 2. Observe the wave after the wave. That tiny rebound, milliseconds after the primary pulse, it's the self-correction surge, the fascia's own homeostatic whisper. When you sense it, don't intervene. Allow it. The body is recalibrating itself. Technique 1. Neuro-Resonant Loop. Maintain circular micro-movement until both fields hum in unison. You'll notice tremors fade, breathing deepens, and ocular tone softens. This loop resets neural feedback circuits. It's the living demonstration of coherence between the somatic and the conscious field. Technique 2. Fascia echo map. Glide slowly, 1 inch per second, while mentally repeating the word still. The repetition entrains cortical alpha and induces mirror neuron quieting. Sensitivity amplifies. You'll feel the fascia echo your intention like sonar. This is diagnostic and corrective at once. Technique 3. Quantum release touch. Withdraw the hand with extreme slowness until the warmth turns to cool. That micro-temperature shift marks the completion of neural reset, the instant when stored sympathetic energy dissolves. Record that feeling. It's the measurable endpoint of resonance. And now, the rarest gem. The space between two silences. The silence before you touch, full of potential. The silence after release, full of transformation. Between them lies the entire science of healing. Awareness becomes medicine. This isn't mysticism. It's measurable coherence. Biofield alignment reflected in heart rate variability, fascia conductance, and EEG harmony. So remember, the highest therapy isn't done to the patient. It happens with them in shared resonance. The hands may rest, but consciousness continues to heal. The greatest tool in physiotherapy is not manipulation, not modality. It is mindful presence. That is the heart of Neuro-Conscious Resonance Therapy. Concept by Dr. Km Annamalai. Thank you.